Okay, good afternoon, and thank you for being here today at PSHSA's Return to the Workplace virtual conference. My name is Seth Sobel, the Manager Occupational Therapy here at PSHSA. I am pleased to welcome you to this session, City of Waterloo Returning to the Workplace during COVID-19, with Kathy Wiedhaus, Lisa Dunlop, and Ryan Schubert. Before we begin, I want to mention that there will be an opportunity to answer a few questions following the presentation. Please feel free to enter your questions in the chat, and we will select some to ask from there. So first off, I would like to introduce you to our featured speakers. First, we have Kathy Wiedhaus. She is the Director of Human Resources at the City of Waterloo with almost 20 years of experience in the municipal sector. Kathy has worked in many areas of HR, including employee relations, training and development, and performance management. She has had the opportunity to work with emergency services and sits on the EOC at the city. Lisa Dunlop is currently the Manager of Health, Safety and Wellness at the City of Waterloo, responsible for city's health and safety management system and disability claims management. While Lisa's career began in disability management, she quickly recognized the field was more so reactive and wanted to learn more about proactive approaches to reducing the incidence of illness and injury. Lisa went back to school to complete a certificate in health and safety and now combines her knowledge of health and safety and disability management to reduce the incidence and impact of illness and injury at the city. And with them is Ryan Schubert, who is a Deputy Fire Chief with the Waterloo Fire Rescue and has been with the City of Waterloo for 16 years. During this time, he has worked with the Fire Suppression Division before transitioning to administrative position in 2013. Prior to entering the fire service, he worked as a primary paramedic in Northern Ontario in both city and rural settings. Ryan is committed to the professionalization of the fire service through continuous learning and creating a culture of excellence. Most recently, Ryan completed a Bachelor of Science degree in Emergency Services Administration from Utah Valley University and plans to begin a master's program in 2021. Through his community-based work, he represents first responders and municipalities both locally and provincially through a number of advisory councils. So, without further ado, I'd like to welcome Kathy, Lisa, and Ryan.
Thank you. I'm just going to get set up here with our screen. Perfect. Okay, so thank you for those introductions, and I will pass it over to Ryan. Thank you.
Great, thank you, Seth and Lisa. So on behalf of the City of Waterloo, we really appreciate the opportunity to be here today, and a special thank you to PSHSA in particular. So with respect to, we'll provide a bit of an overview for those who are not familiar with, in particular, the City of Waterloo. But the City of Waterloo, of course, is situated in southwestern Ontario. We, along with our neighbors, form the larger tier government, which is the region of Waterloo, and we share that the region of Waterloo with, of course, 7 other municipalities. Being the larger centers being Kitchener, Cambridge, and Waterloo in the region. With respect to the City of Waterloo in particular, we do have approximately 600 permanent staff and also 400 temporary and also seasonal staff. The community is made up of, and primary basis for industry, etc., is that we have actually three post-secondary institutions: Wilfrid Laurier University, University of Waterloo, and Conestoga College, and other important sectors and primary employers within the community include the technology sector as well as insurance-based sectors as well. So as we reflect on this presentation and developed it for this particular conference, in essence, we'll focus on some of the actions and activities from a pre-pandemic state right through our response through to our recovery phase, which we're currently in right now.
Great. I'll take over here. And I just want to talk about our compass, or how we were guided through this process. We started off with our corporate mission, vision, our mission, values, and guiding principles. And this included items like fiscal responsibility, equity and inclusion, accountability, sustainability, delivery of service excellence, healthy and safe workplace, and effective engagement. All of those things were considered as we were planning through this pandemic. We had a phrase that we often used that is, perfection is the enemy of good, and that's from a United Nations quote, because we recognized that as it was a quickly evolving situation where the things that we did today would be outdated tomorrow, and we were giving ourselves the room to adapt and adjust without the pressures of perfection. We also made sure that we were taking care of ourselves and used often the phrase, it's a marathon and not a race. It could last weeks. We knew that at that point it could last weeks, months, or even a year. So just ensuring that we were taking care of ourselves.
All right, thanks, Kathy. So transitioning now to really a focus on the pre-pandemic efforts, really started with meetings with our system partners within the region of Waterloo. That was based upon many agencies within the region having a solid emergency plans in place, pandemic plans as well, along with long-established policies and procedures, which were really helpful during the preliminary meetings with some of the initial actions and activities. So that foundation was critical to our success. With respect to modifications of agreements, one that I'd like to speak to in particular was a modified agreement with paramedic services, and really the notion was to prop up the healthcare system and share some of our PPE, or personal protective equipment, inventories with paramedic services, and that was as a result of the burn rate and consumption rate which we were seeing across the region. So some quick actions and activities were required in the pre-pandemic phase. In addition to that, placing orders immediately for additional personal protective equipment was critical as well. Again, we had opportunities to receive delivery of some goods, and then others remain on back order. So there was sort of some critical actions and activities. In particular, from a broader context, assembling city and regional control groups, again, which were by large and part making decisions both at the municipal level and then, of course, at the larger tier government at a regional level as well. And really, the overarching approach was to ensure that municipalities were as consistent as possible, align with municipal decision making, that we were aligned and somewhat consistent, and then also looking to have a similar level of service, if at all possible, among the 7 municipalities. The community emergency management coordinators, the CMCs, did a critical services analysis, and that was based upon the evolving legislative changes and really determining what service needed to continue, and making that those recommendations through to the various emergency control groups. The other piece to this, of course, which was a unique challenge, was of course preparing staff to work from home, which was something that corporate services and human resources helped support with IMTS, or technology services, rather. Okay, now transitioning into the response phase. So again, ongoing discussions and alignment with our local partners. So that again, with respect to if one agency's taking particular actions, it was very important to be as consistent as possible, and or communicate with our neighbors to ensure that they were aware of actions and activities that would potentially be impactful with respect to our neighbors. A reduction in critical services, of course, only on site. So critical services continued in the community. However, really it was with respect to the support and people working from alternative locations that ensured that the continuity of service continued where at all possible. Modifications to the service delivery to meet the community's needs and evolving situation. That was with respect to there's critical services with legislative services, bylaw, fire, finance, payroll, human resources, and of course economic development and planning and public works. We really needed to be, all departments needed to pull together and really be creative to ensure that they would be able to continue to deliver service given the COVID-19 pandemic. The other piece with respect to response around new practices and communication is even leveraging technologies, and we'll talk a little bit more about that, and Lisa and Kathy will, with respect to lessons learned. But really, by large in part, it has changed our work environment. Where meetings are being held virtually, and I expect some of that to continue here forward. It's certainly changed the world that we live in. In addition to that, postponement and suspension of events, non-mandatory, and the establishment of both mandatory and non-mandatory training, and of course work-related travel also being suspended, with many conferences, etc., being canceled by large in part the current legislation which remains in place.
Thanks, Ryan. And I'm going to recovery. So the city switched from to recovery planning near the end of April and the beginning of May. And there were a few key pieces that we looked at for recovery, and certainly continue to look at through the recovery phase, which we are still in. So one was the development of a corporate phased recovery framework that was led by the CAOs and divisional based recovery plans. So that was really important because we have a lot of business under one roof. And so we needed to understand with each phase what was going to be reactivated. So would parks be opening? Would pools be reopening? Would camps be going? And what did that look like? So that document has been really helpful. And part of that was also implementing principles. So for example, one of the principles was following the guidance. So even if we have a plan in place, we need to be fluid with that plan just because we aren't sure what the future holds in terms of government directives. So that was a great corporate guidance document. We also had divisional completion of what we called the Etiquette and Recovery Tool to prepare for return to work. So that was an Excel document that each division completed to start thinking about their needs. So what signage do they need, or decals? Do they need hand sanitizer for their divisions, or other PPE needs? And so that really essentially was a catalyst to get divisions thinking about what do they need for their unique work areas related to recovery, because we were so focused for a period on response and needed to change gears, but we wanted to give divisions some alignment where we could. And part of that in the implementation was that we also wrote and recorded a mandatory health and safety training video for all staff. So it was about 30 minutes, and we were able to just put it on a link and send it to all staff and request completion. And we are nearly there. I think we maybe have one more employee, which is great because, with getting all those employees trained, we felt it was so important because it gave that consistent messaging. And I'm sure a lot of the organizations listening today, you'll notice that you have had so many separate conversations, but it's difficult to get all that consistent information to your full staff. So we designed a video that talked about signage and self-screening, PPE, and even the psychological components associated with the pandemic. So that worked really well for us. And lastly, we moved to actually implement. So the development of the phased recovery, as well as the etiquette tool and the health and safety training, those were all preparation. And then we actually need to move forward with the implementation. And some pieces of this service are still ongoing for buildings that are not yet open to the public. So that was implementation of signage, which we standardized through our communications team, physical distancing floor decals, physical barriers, so actually for customer service areas that didn't have them, and also implementing other things like staff rotation and staggering, shift staggering, which was especially important for our employees that were unable to work from home. And so we needed to prioritize getting them back into the workplace to ensure that we kept those employees whole as well. So that kind of wraps up from the actions that we took, and we certainly are still in a position where we are learning a lot, but wanted to share some of the things that we have learned from our experiences so far. And depending where you are at, your team might still be in response or working primarily from home, but some of the takeaways that we've had from actually reintroducing employees into the workplace. So the first important lesson we wanted to talk about is adaptability. This is really key in the pandemic. And, you know, at a municipality, a lot of the processes have been in place for a long time. And I really was impressed with the city's ability to really quickly adapt, considering that those processes were so in place. So a few things that we found that were really helpful is having a business continuity plan. So we actually did need to update our business continuity plan, but it had a really good framework that we were able to work with and update quickly so that we were prepared for this and another emergency that could come our way. One thing, so being the manager of health, safety, and wellness, I've only been at the city for less than 3 years, and what we've been really working on is the documentation of our processes and risk assessments. But they are not complete. And so we found that that was a little bit of a challenge. So instead of being able to take a risk assessment or take a procedure and just adapt it for COVID, some of it was taking, starting from scratch and moving forward with that. So a good example would be with respect to personal protective equipment. What I like to have is more so of a matrix where it says, by the job, what PPE is required. And since we didn't have that, we had to kind of start by contacting all the divisions to understand their needs. So it was essentially an extra step in the process when we really didn't have a lot of time. So in the end, it worked out well, but it did require a lot of extra time. So that's something that we knew that documentation was a little bit of a gap, and we have worked to add a lot of good documentation, but that certainly is important going into this. And if you have the time to prepare documentation ahead of time while you still are in the response and headed to recovery, that would be ideal. Ryan already touched briefly on adequate and sustainable PPE inventories. So I'm sure everyone is aware of the global shortages that we've experienced and the difficulties in obtaining PPE. So certainly, especially, emergency services, really important to have that available to you. And we were lucky that we were able to obtain a lot of the PPE that we needed, of course, reserving certain items like N95 masks for healthcare workers or within our fire services. But I know even fire services was trying to preserve that stock as well. And certainly we didn't always have our preference of what PPE we had, but we were able to source it, but certainly a challenge. And we will consider, planning ahead of time for potential future health crises. And moving on with adaptability. So one important thing is being prepared to make quick changes to common work practices. And Ryan touched on this a little bit, but certainly our IT team did a really great job of being able to transition and give employees that were able to work from home the access that they needed, because prior to the pandemic, there were certain employees who had access to their files at home, but most just had access to their emails. So I think, within a week, we had a lot of people set up from home, which was amazing, and, great work from our IT team. We also had to adapt to other types of inspections. So for example, virtual or video inspections that it took a little bit of time to set up and work through the legalities of that. But but certainly something we're able to adapt. And of course, electronic filing and signatures. So in a municipality, we were always kind of getting the wet signatures on everything. And so switching to the electronic filing and signatures of council reports and financial reports actually went quite smoothly. So that was great. So like I said, the city has been really responsive to making those quick changes and very creative with how to accomplish that. And lastly, for adaptability, I just wanted to talk a little bit about the fact that we learned that solutions can bring new issues, and perhaps we always knew that, and it was just amplified in this. So for example, with health and safety, if you introduce, say, for example, or considered the introduction of a physical barrier, then we quickly learned some of the issues that could come of that. And, you know, with our heat wave that had come recently, we were worried about a barrier preventing air conditioning flow. So sometimes implementing a solution that you think works well, there's a lot of other considerations. So taking your time to assess that, and we know everyone has to work quickly, but just kind of considering all the impacts of what you are implementing. And another one was at accessibility. So when you are re-entering the workplace at reduced levels, you also have to look at, for example, washroom usage. And we implemented a system where you would use like a pylon to let someone know when you are in the bathroom. And then that brought some issues in terms of accessibility. And we've worked through all the issues, but it certainly was interesting to see that solutions could bring about new issues so quickly. And one of the really good examples of adaptability comes from Waterloo Fire Rescue. So I'm just going to turn it over to Ryan to talk a little bit about that.
Sure, thanks, Lisa. So likely one of the most significant and evidenced by our adaptability was transitioning one of our pumper rescue units to the Waterloo Memorial Recreation Complex. And what this did is that our fire station number one is what we refer to as a 2-truck haul. So we have an aerial truck and a pumper rescue truck that respond from that particular station. And we made the decision as through the emergency control group and as an administrative team to basically social distance those two crews, the aerial crew and the pump crew, and did have a pumper rescue respond to Waterloo Memorial Recreation Complex, where essentially in the course of about 48 hours, we were able to have a crew of 4 assigned to that apparatus and responding to the community from that particular location. So it actually, in essence, provided a greater opportunity for greater standards of coverage to the rest of the city of Waterloo, being that the arena, of course, during that time was closed to the public. A few other examples of some of the other elements of adaptability was that based on the speed and transition of the evolving pandemic, information sharing with staff was so critical and important. And what we did early on in the pandemic was to consolidate some of our higher profile committees, such as health and safety, our union executive, senior officers, platoon chiefs, etc., and involving them in larger meetings to ensure that the information and evolving situation that information was getting to the masses within the organization. I alluded to earlier about the element of ensuring that you have a strong foundation, and we did have strong policies, I would say policies and procedures in place, but based upon the speed of the evolving pandemic is that the details associated with the perfection, I would say, of a policy, we transitioned quickly to directives, and then directives were actually issued, written directives were issued via memorandum throughout the organization. So that was pretty much based upon the speed, and of course, as Kathy alluded to earlier, perfection being the enemy of the good. And we know that many of those directives, essentially as soon as they were sent out as technology, in some cases, is that it was out of date and perhaps redundant, requiring a secondary evaluation and fine tuning. One critical activity, of course, training is so important for all staff, but in particular firefighters, and ensuring that their skill sets are honed and that they can continue to deliver service within the community. And so at one point we had to suspend our practical training for a period of time, and we basically transitioned to theory-based training, and that went on for pretty close to a month. But during that time, we focused on basically an evaluation of the continuity of training, and evaluated actually each individual job performance skill that would have to be performed, and then had our training officers establish control measures which would be in place in order to satisfy that performing that particular skill. Presented that to the Health and Safety Committee as well, and we resumed practical training about a month later, and of course maintained social distancing throughout those training evolutions. One particular area of interest, which has been very profound in the media and within our respective communities, of course, the focus on long-term care and retirement homes. And we quickly involved our hazardous materials team for more advanced response if it was required to long-term care facilities and retirement homes. And that's as a result of the general regular day-to-day shift staff would not be able to provide long-term support to a long-term care facility or retirement home. And as a result, we do have a number of staff who are trained with respect to CBNRNE training with respect to hazardous materials, and they were in a position to mobilize and support the healthcare system and perhaps the military if so called in. Another area within the support services area with respect to our mandate around providing public education. So we've become adaptive and are continuing to provide public education and public safety messages via social media outlets, etc. And also our fire prevention division, which of course needs to continue with community-based inspections and high-risk inspections for that matter. We've even transitioned to utilizing Zoom and other platforms to ensure compliance with owners. So those are just a few examples specific to Waterloo Fire Rescue of evidence of our adaptability during the pandemic.
Thank you, Ryan. So our next lesson learned is collaboration. So certainly being under the umbrella of the region, we have lots of partners to collaborate with, and we did create opportunities for early collaborative involvement and efforts from senior leaders, local municipalities and organizations, pertinent committees, and of course our unions and association, which was key because we did need to make really quickly, and so having those meetings with unions and association just made sure that we were always keeping those employee groups in the loop. We shared resources with other organizations to avoid reinventing the wheel with respect to training or procedures, or how do we manage first aid, or how do we manage PPE usage, or when are we requiring non-medical masks versus medical masks, and all those things. So we were able to bounce ideas off of others. And of course, utilizing resources from the PSHSA and other health and safety associations. So again, in the spirit of not reinventing the wheel and being able to find credible information within our community, that's really helpful and been reassuring as we work through this process. And certainly in the spirit of collaboration, if any of the tools that we have mentioned today you're interested in, certainly reach out to us after the session.
The other lesson learned was related to communication. And I think that we started out communicating transparently and regularly with staff. I just looked before this presentation. Our first communication to staff was January the 27th, and the next one was February the 27th. So they were a month apart. Then they went weekly, then they went daily. So we've done 40 regular internet posts to date. We're down to weekly again, and we have daily virtual leadership calls, which then moved to 2 per week, and now we're down to 1 per week. We did weekly meetings with our labor groups, their unions and associations. And then we had monthly virtual general staff meetings with all staff, and that would be hundreds of people on the line at a time to listen to the information. And we worked with public health on the communication related to COVID-19 diagnosis of employees and where that information sharing needed to happen. We give opportunities for people to ask questions at all levels, and that was anonymously, so gave them the privacy to be able to share their questions. And we sought out and shared credible information that considers the local context, which was extremely important. We used recognition items such as buttons, stickers. We have T-shirts that we're getting from the Grand River Healthcare Foundation or Hospital Foundation, and fabric masks as well. And we, as Lisa's talked about, we had the visual reminders of the signage and the decals in each of our areas. For the second big, or another one of the big lessons learned was the psychological impact. We were ready, we thought, for the psychological impact of employees, and I can't say strongly enough that you cannot underestimate the psychological impact that a community emergency will have on your staff and on their families. You need to provide employees with factual information from credible resources, including a baseline of knowledge of pandemics and communicable diseases, modes of transmission, and precautions. We utilize the information from public health on a regular basis to do that. You need to provide psychological resources to employees, and we used our Employee and Family Assistance Program to do that. And let your employees know what has changed and show them what they will see once they return. So prior to our final decals going on the floor, we came in and put painter's tape down and sent pictures out to employees to say, this is what your work environment is going to look like. This is what has changed, and this is what it's going to look like when you return. The other thing that we realized is that you need to listen to every employee's unique return to work concerns and identify solutions collaboratively. So work with the employees and ask them what the barriers are and how can we help them with that. Meet employees where they are. This is a difficult time for everyone, and we have to be very understanding and just to be kind to employees to help them. As I stated, we were not prepared for the depth of the impact that we were not resourced to respond to the psychological impact. The employees who continued to work throughout the workplace, even during a reduced schedule and during the pandemic, were much more comfortable in that working during the pandemic. The employees who did work at home for a period of time or a longer period of time have shown a greater resistance to return to work and returning to the unknown. There is no one-size solution fits everyone, and we have to address the individual needs. I will say, though, as the more we've had employees returning, the more that they've said, it's not so bad now that I'm back here and I've seen all the changes. So just make sure you put the time into that psychological impact for your employees.
Okay, thank you, Kathy, Lisa, and Ryan, for sharing your experiences and considerations for returning to the workplace with us today. So throughout the session, we've been monitoring the chat and noticed a few questions. So at this point, I'll hand it over to Tim to relay those questions.
Thanks very much, Seth. So the first question was from Christine Fink, and her question was, is there a specific health and safety risk assessment tool that you used?
That's a good question. So I think initially we did. In the end, we did have a tool that we used and we developed in the response phase. And that was really to identify, who needs physical distancing, who needs barriers, who needs personal protective equipment, where do we need to do vehicle inspections. But I wouldn't say it's necessarily usable at this point. But I do think that, if you develop your own tool and look at those standard pieces, I think it's more effective to to say, okay, we need to physical distance. What are the options? And then apply it to your certain areas. So I do have the Etiquette and Recovery Tool, and I put our contact information up on the screen so I can share the resources, but I would say it was more of an informal risk assessment. We did have a spreadsheet that tracked by division, but really the same controls basically applied to all. It was just the implementation of it that might have been slightly different.
Excellent. Thanks for the answer. One more question from Karen Jennings. She mentions, I am curious to know how your health and safety training link was set up. Any suggestions would be appreciated.
So I actually have the full presentation that I am willing to share. So again, if you want to send it to me, feel free to do so. And in the interest of time, the way that we did it is we set up a PowerPoint with speaker's notes and presented it live on Zoom to our leadership team. And our IT team actually recorded that, and then they were able to put it on a private Vimeo link, similar to YouTube. But we didn't want to work through the logistics or have delays for the training related to getting that into our learning management system, which doesn't really have, it's kind of limited capabilities. We ended up just distributing the link to all staff, and so they could literally just press play. And we did somewhat of a manual sign off where our team was emailed with completion, which was a lot for the number of employees, but we were working so quickly and just thought, you know what, if we can start a spreadsheet, pull an active employee list, and they tell us once they've completed the training, that worked well. And for groups that don't have access to computers, we actually had just a sign-off sheet where the managers would set up a computer for them to watch and sign off and just make sure that there was physical distancing in the room. And that was quite effective. And like I said, out of all our staff, I think we only have one person maybe who hasn't completed it at this point. So we were impressed, and that all happened within less than 4 weeks. So I would highly recommend just a very accessible format, and you can record through Zoom. So I know PowerPoints allow you to do recordings, but it takes time and you have to edit. So we just did a one take, recorded it, and send it out, and it worked great for the city.
Thanks for the answer, Lisa. It's a phenomenal way to take care of that situation. One more question just came in from Sherry Hartman, and she's just asking where your slides will be available.
We did send them to the person that we were working with, and I'm not sure how those are accessible. So we did share the slide deck already, and I'm not sure, that might be a question for your team on how to get that information out to staff.
Yep, so there will be a link available in this session, and Seth, you can correct me if I'm wrong on this, but there should be a link available in the same location after the session is over, where you can download the materials if you've already provided it. So that's
Perfect.
Likely where it will be, but I just wanted to make sure that we addressed Sherry directly.
Perfect.
Thanks for the response there. So I don't see any other questions. If you wouldn't mind stopping sharing your screen, and I'll throw up the Q&A slide that we had here. Just give me one moment. And we'll just give a moment for anybody else that may be in the chat that didn't get a chance to ask any questions yet, to feel free to insert those questions into the chat. And with that, if we don't see anything in a few minutes, Seth, I will certainly turn it back over to you.
Sounds good. Sounds good.